So the first pattern is breathing and core activation. This pattern is so important because it sets up every other pattern we're going to do. People often skip over this piece because they're like, oh, I breathe every day, I move every day, my posture's okay. But this pattern is key to setting up all the other patterns we will do. This pattern is key to posture, to the health of your body, to the health of your joints, and to help stabilize your back against things that cause back pain and neck pain, because oftentimes these things originate from not having enough core stabilization, but also the optimal core stabilization. Breathing helps set up optimal core stabilization. So despite what you read about core stabilization is set up by proper breathing. So for some of us, we're going to need a towel underneath our head because it's going to help align our head in line with the torso. We want the rib cage aligned over top of the pelvis. And that doesn't mean tucking your butt in, squeezing your shoulder blades down and back. It just means we're going to breathe to help bring that rib cage down so it feeds down into the pelvis. So we can tie the abdominal muscles together to create the nice corset effect that we want our core to do to help stabilize us and create enough pressure internally to help decompress our spine. That's really the benefit of doing the breathing. So I'm going to get down on the floor and demonstrate it. If you can't get down on the floor, you can do it on your bed, but we'd rather have you on a more firm surface so you can get the feedback and get yourself in a better alignment than the bed provides you. However, like I said, you can do it in the bed, line yourself up properly. So I'm going to put a towel underneath my head to bring my head in a more neutral alignment, and you're going to see my torso is going to be in a nice straight line. My feet will be at 90-90 position against the wall. You can also place them on the edge of a couch, chair, coffee table, anything you have to help you align your body and get you in the right position. So I'm going to line myself up. My chin is slightly tucked, but my neck stays soft. My rib cage is facing down towards my rib cage, or towards my pelvis. My knees and hips are bent 90-90 with my feet against the wall. Again, I can do this without my shoes on so I don't mark up my wall, or I can put them on top of a couch or coffee table. My goal is to expand and breathe three-dimensionally, so I'm going to breathe this way, also down into the floor. Not just belly breathing, but breathing down and back into the floor. So I get mobility of the spine, as well as that intra-abdominal pressure to help stabilize the spine. So I'm going to put my hands lightly on my rib cage, and take a deep breath in, let it out, and let the rib cage drop down towards the pelvis without rounding my shoulders. Keep the shoulder blades relaxed, not pulled back, just relaxed. So I'm going to breathe in again, breathe out, and again I'm thinking about going wide as well as front to back, really trying to breathe down into the floor. I'll do it one more time, and let it go. The next component, I'm going to keep my fingers here, and I'm just going to tense up my abdominal muscles really gently underneath my fingers. I want to think about doing this. As I activate, I want to do this, not suck in, not try to flatten my back towards the floor, not try to raise my pelvis up. I just want to maintain my nice spinal alignment and just gently create tension in the abdominal wall. So I push my fingers in and create a little bit of tension, and I continue to breathe into that tension, keeping my neck relaxed, keeping my spine relaxed, but creating just that little bit of corset function of my abdominal muscles as I continue to breathe. Because this is the key to stabilization, being able to activate the core at the same time you're able to breathe three-dimensionally, front to back, side to side, up and down. Keep the activation, breathe. I keep that activation and breathing strategy, and I can lift the leg up, keep it up. I can lift another leg up, keep that alignment, no straining through my shoulders and or neck. Drop one leg back down, drop one leg back down. Keep that alignment, keep the breathing. Breathe in, breathe out. Breathe in, breathe out. Drop one leg back to the wall gently, controlled. Drop the other leg back, controlled. Without any movement or pressure in my back, I stay breathing three-dimensionally. I stay with my core activated. And I can repeat that for 10 repetitions, taking a break after 10 repetitions, or increase up to 20 and 30 repetitions once I understand and have good control. The next pattern is the doorway supported squat. And the doorway is not to hang off of, it's just to help connect your shoulder girdle to your trunk, to your lower extremity. This position will use exactly the same position we had on the floor, the nice long spine position, the rib cage being soft in the front and connected to my pelvis. And the posture that we took down on the floor, we want to take into a standing position. The door, pressure down on the door handles, creates that connection and that increased core activity that I want. I want to make sure I sit back in my hips. I want to make sure that I don't jam my knees forward, I don't hyperextend and or around. I'm going to keep that nice neutral posture all the way up, all the way down. So I'm going to put my hands on the doorknob, push down lightly, put my feet about shoulder width apart, keep that nice alignment, spinal alignment, and just squat down and come back up. I'm lifting and lowering from my glutes, not just my quads. Everything's working together. Keep the nice alignment, come back up, nice and tall. Squat down, keep the pressure, come back up. Come back up tall. No rounding, no hyperextension, just stay nice and long through your spine and keep the movement nice and smooth and controlled. I want to continue to breathe three-dimensionally, side to side, front to back as I go through my squats. The next pattern is a pull pattern. And the pull pattern works all the muscles in the back of the shoulder, the arms, as well as the entire spinal muscles. It's one pattern where you will require a band, and we prefer the bands that have a doorway attachment so you don't ruin the band by putting it in the doorway. You can get these at most athletic stores, and you can order them online, and if you need to know where to get them, we sell them here in our office, but you can also let us know and we can direct you to the right place to get them. We're going to attach the band into the doorway. We're going to again use that nice posture, the nice three-dimensional breathing, and we're going to pull into a nice upright posture. We do not want to squeeze your shoulder blades down and back as many people are taught and cued. We want to stay wide through our shoulders, long through the spine, and pull ourselves into good posture. So we'll do that right now. I've secured the band in the doorway. I'm going to grasp with my palms facing each other. I'm going to stay again in that nice neutral spine posture. Chin down lightly, rib cage down lightly, slight core activation. Again, breathing three-dimensionally. I want my shoulder blades wide and long. I want to think about pulling my elbows right to about here, not so far back where I start putting the shoulder or the neck in a compromised position. I'm going to keep this posture throughout the exercise. So I'm going to take a semi-squat position, keep the weight back, and my glutes stay in nice, good posture. Again, I'm just going to pull and release. Just pull, release. Nice, good posture without squeezing anywhere. Just pulling in a nice, smooth cadence. Continuing to breathe in a normal pattern, three-dimensionally, with my core staying active. I perform up to 15 to 20 repetitions depending on the tension and intensity of the band. The next pattern is a split squat pattern, and again, we're going to use the exact same mechanics from the squat pattern. We're going to keep it nice alignment, three-dimensional breathing, core activation. The only difference is rather than having our feet parallel, we're going to take a staggered stance or a split stance. Okay, so one leg will be forward, one leg will be back. The majority of the weight will be on the front leg, so about 80% of the weight on the front leg, about 20% on the back leg. I'm going to use the opposite hand forward, so the right leg is forward, the left hand is up against the door frame. I keep good posture here. I want to keep the weight back in my glutes and stay nice and upright here. And then come up tall with the weight on the front leg. So come down, come up tall, down, up tall throughout the pattern. Watch your posture, watch your breathing, keep your rib cage down, use the glute so it's not all in the quad and comes out your knee. Switch sides. Again, the weight's in the front leg, 80% of the weight, 20% on the back leg. Keep good posture, good alignment. Keep breathing, and do about 10 repetitions. The final pattern is a great exercise for the shoulder girdle, posture, and the entire core area. It looks really simple, but when you do it properly, it's incredibly effective at improving both the shoulder position, stabilization, the head, neck, and shoulder alignment, as well as working the core. Because the key is not to make the exercise easier, but make it more challenging by doing it specifically and properly. I'm going to put my hands flat against the wall.
I'm going to lift one arm out to the side and bring it back, and then alternate each side without any shift of my torso or minimal shift of my torso. I'll show you what a good one looks like, and I'll show you what it looks like when it's faulty, and how people actually make it easier by doing it improperly. So I'm going to place my hands against the door. Make sure the door obviously is closed tight and nobody's going to open it on you. I want to make sure my shoulders come down and around my rib cage. So down and around this direction, not down and back this way, but down and around, wrapping around the rib cage. My head and torso is in a good posture again. And I want to lift one arm off to the side of the wall. The arm that's stationary is doing the work. I stay stable and come back. Lift off the wall, come back. Common mistakes are people will shrug their shoulder up and around, or just lean backwards. So I want to make sure stay set, good posture, breathing three-dimensionally, keep my core activated, lift off, rotate, come back, control, lift off, rotate, come back, control. And we'll do that for 5 to 10 repetitions per side. So this is Dr. Evan Osar. I hope you enjoyed this video series. It's a quick, easy program you can do anywhere, anytime with just your body weight and a band if you haven't. Make sure that you do exercises that are at your level, that are safe, and that don't cause any pain. If there's any pain anytime during any exercise pattern, stop the exercise immediately and consult with your chiropractic physician. Make sure you have clearance before you start an exercise program if you do not currently exercise, and we're happy to help you if you have any questions or concerns about any of the exercises, or if you want to see if your exercise routine is being as effective as it can be. Hope you enjoyed this video series. Have a great day. We'll see you next time.